The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and thank you for joining our webinar this morning, Practical Solutions for COVID-19 Workplace Testing. Before we begin, I want to start off with a few notes about this webinar. The webinar is being recorded, and all registrants will receive a copy of the slides and a recording via email within 3 business days. The presentation will end with a live Q&A session for you to ask any questions you have to speakers. During the presentation, you could submit your questions using the GoToWebinar sidebar menu. Select the Questions tab, type in your question, then hit Enter on your keyboard. Remember, you can submit questions throughout the presentation. Any questions that we don't get to during the Q&A session, we'll follow up with after the presentation. Okay, now I'm going to introduce you to both of our speakers today. Richard Higbee is Vice President of Microbiology for Eurofins Microbiology Laboratories and has a PhD with 30+ years experience in serving manufacturing and contract laboratory management. Jennifer Willig is a Senior Consultant for Eurofins Assurance. With a PhD and over 15 years of experience, she helps manufacturers, distributors, and product packagers navigate the complexities of the latest standards in order to achieve compliance. Okay, Jen, I'm going to let you take it from here. Thank you.
Okay, great. Thanks, Genevieve, and welcome, everyone. I'd like to first start out by introducing everyone to Eurofins, just in case you've not heard of us. We are a world leader in testing for life. Our mission is to contribute to a global health and safety through our high-quality services, and that includes our testing services and our assurance services. We have over 48,000 employees with over 800 laboratories, and we're also located in over 50 countries. So with that, I'd like to go to the next slide. So let's get into the meat and bones of today's presentation, which is practical solutions for COVID-19 in the workplace setting. Let's speak a little bit to COVID-19 current state. Currently, companies are faced with urgent health and safety concerns associated with the novel coronavirus, and this includes workforce shortages, employee-to-employee transmission of the virus, and employee walkouts. These factors are leading to supply chain uncertainty and have serious impacts on business continuity. Because of this, there are some services that we put together under our Safer at Work program to help you effectively manage these health and safety concerns and concentrate on what makes a difference to your bottom line, which is obviously protecting your employees and maintaining and growing your business. Next slide, Genevieve. So how do you do this? How do you protect your employees and your business? We know it's really difficult to prescribe social distancing in all workplace settings, especially settings where people work in close proximity to one another. Employees and customers feel vulnerable and distracted and fearful to return to work. And this causes a lot of supply chain disruptions and statutory restrictions and workforce unpredictability, leaving business leaders burdened with keeping the doors open. So because of that, we've stood up our Safer at Work program and services to go along. Next slide. So our Safer at Work COVID-19 program really relies on 6 main pillars, which include readiness for reopening and legal compliance, an infectious disease preparedness and response plan, implementation of preventive measures and workplace controls, policies and procedures for prompt identification and isolation of infected people and remediation of contaminated surfaces, employee awareness training, and business continuity planning. So I'd like to get into a bit more detail on each of these pillars in the next slides. First, our program really likes to focus on risk considerations. So when you're considering a back to work program, you're going to want to consider risk and assess the following types of risk. First, you're going to want to identify where the risk is coming from, how it is implicating your or impacting your employees and what you can do to control for it. So you're going to want to look into your people, the environment within your business, home and community settings. This includes regional and local city infectivity rates, and transportation to and from work. Once you've identified your risk, you're going to want to assess that risk and identify the exposure potential, and also understand the COVID-19 positive test rate within your employees, and again, in the local cities and regions in which your business lie. And then lastly, you're going to want to prioritize risk in a high, medium, low category to determine if it's necessary to test your employees, or perhaps limit the number of employees that you're bringing back to the workplace. Next slide. So how are you going to effectively implement a plan once you've identified risk? Well, you're certainly going to have to do a lot of communication and training for your employees. And that training really should include the following. You should, at minimum, do an awareness training for your employees. And this should really cover not only any scheduling and operational changes, but what's required of the individuals when they come back to the workplace, or what's required to remain on site. You should also include cleaning and disinfection protocols, good hygiene practices, specifically hand hygiene, and personal health and self-protection. So this is something that I think is quite difficult for the US, is to stay home when you're not feeling well. So having some training and awareness around self-reporting and not coming to work when you're sick is going to be really important. Next slide. You're also going to want to implement continuous monitoring. So you'll want to consider including clinical and environmental testing. Continuous monitoring of your staff and your environment will certainly help you gauge what individuals' health looks like, and specifically can act as an early warning system to help you make decisions should you see your infectivity rates increasing. You'll also want to consider doing PPE monitoring. So if you have a face mask requirement, you're definitely going to want to have some self-policing of your employees just to make sure that people are actually using the proper protocols. Body temperature checks upon arrival, social distancing signage, just to remind folks not to congregate. You may also want to consider implementing some traffic flow pattern signage, one directional flow, limiting the number of people who are allowed in and out of elevators and stairways. And then you'll also want to consider what your community and regional positive case rate looks like. This image here is a great image to kind of visualize the impact of contact tracing. So we've got our guy up here in the front right corner with the red mask indicating he's positive for the virus, and could potentially be of harm. One service that Richard will be going into detail on in the coming slides is our used mask testing, but that's just a great example of an early warning monitoring system. You'll also want to consider safety precautions to use while commuting to and from work. So for instance, if your workforce is using mass transit to get to work, having some awareness training on how to behave on that commute will definitely help decrease the risk of COVID-19. You should certainly try to encourage folks to walk to work if that is something that they can do safely and within a reasonable time. But if not, you'll want to also mention to your folks, hey, try to avoid unnecessary stops to and from the office place, pooling of employees if they can possibly do so, and then maintaining that social distance. And then certainly hand hygiene and good hygiene practices upon arrival to work. Next slide, please. Cleaning and disinfection should also be taken into consideration, and your frequencies of cleaning should be increased. Before sanitizing and disinfecting, you must first remove any debris and thoroughly clean. And then also it's really recommended that you use an approved disinfectant that is effective against SARS-CoV-2, which is the virus that causes COVID-19. And there's a number of websites and resources to help you find these approved disinfectants, including the EPA's List N tool, which you see an image of on your right. Also, the European Chemicals Agency and the World Health Organization have great resources to help direct you to the appropriate disinfectant for your environments. Okay. And then lastly, really encouraging that personnel hygiene and social distancing are being utilized. So, doing a good training on hand hygiene, posting signage for social distancing and traffic flow to remind people of the direction in which they should walk will certainly be of value. So with that, I'd like to turn it over to Richard. He's going to talk a little bit more thoroughly about our testing offerings.
Thank you, Jen, and I appreciate the opportunity to speak to everybody. What we're going to talk about next is we're going to really reach into our tool bag of resources that we have to actually do the testing to support the kind of program setup that Jen's described. So we go to the next slide. And I'm not seeing the slide advance. There we go. We talk about workplace surface testing, and this is going in and actually looking at things like the desks, the phones, computers, keyboards, door touch panels, all the high touch surfaces in your facility that would be an early indicator if we were to swab those, take them back to the laboratory, test them for the virus using a PCR test, and that's the same PCR test that's used actually in the nasal and oral swabs, and see if the virus is present on those surfaces. If it is, clearly you want to get in and remediate it. You also want to be aware that you have a source of contamination in the facility, a staff employee touching those surfaces. Similar to that approach is the testing, and we'll talk about this a little bit more in some subsequent slides, is the testing of masks that are worn by employees. Now we can collect masks, we can pool those into a group of 10, test the entire pool, and then provide a report back to you that says one of those masks was contaminated with the virus. We don't know if it's because somebody touched it or breathed through it. The mask was contaminated. You may want to take some appropriate action. We'll talk about that in a little bit. The other thing that we have developed with the workplace surface testing is we have done some work with the swabbing of food packaging and actual food surfaces, pork, poultry, seafood. And that was in response to a lot of the Chinese import testing requirements. We want to be able to provide a service that if somebody wanted to test their product before they put it on a container heading across the ocean, they could verify that it was not contaminated. So the next weapon in our toolbox is on the next slide, and that really gets to the population monitoring. So you've seen in the news a lot about monitoring of dormitories in congregate living facilities like universities, and monitoring the wastewater coming out of those facilities to see if it has a spike in the increase in virus. And then when it does, it leads to a quarantine of the facility of that building and then testing of the population within. We've done this work. We have been able to detect an increase in the virus in the wastewater ahead of anybody being symptomatic or of having any other form of indicator that there is testing. So it does provide a great early warning system to the population, and this can be done not only in congregate living, but also in industrial settings, manufacturing plants, and that kind of thing. So next slide. So staff PCR testing is the testing that I think we're all most familiar with, where you have sites that are open in some public areas where the government's coming in and funding the testing of nasal pharyngeal swabs or saliva testing and that kind of thing. The testing that we do is a front of nose test, so you don't have that deep probe into your sinuses. Again, the sample sent out to the laboratory, and that comes back as a clinical diagnosis that the person is actually carrying the SARS-CoV-2 virus. Next slide. So as we look from early morning to staff actually carrying the virus, the third tool in our toolbox here is the staff antibody testing. And here we're actually doing a small blood sample and taking that back to the laboratory, and we're checking for antibodies. We're generally looking for the IgG antibody, which indicates that the person's no longer actively infected and has established some longer-term resistance to the virus. It's a good way of indicating what percentage of your population has already been exposed, already developed immunity, and a good way of evaluating your risk going forward. Next slide. And finally, in the final tool in our toolbox is we do a service where we are testing sanitizers for efficacy against the virus, things like hand sanitizers to make sure the level of alcohol is above that 60% threshold. We also test masks for their ability to block the virus and test other products that are on the market. So as part of the global offering of Eurofins, we are totally wrapped around the SARS-CoV-2 outbreak and being able to provide all sorts of services to support it. So those are the weapons in the toolbox. I'll turn it back over to Jen to talk about really the certification program that she can offer to you.
Okay, great. Thanks, Richard. So in addition to our Safer at Work program and our COVID-19 testing offerings, we've set up a COVID-19 verified program, which I'll go over on the next slide. This program is designed to help you assess risk on site, develop a protocol in advance of bringing people back to work, and then also come up with a good testing regimen and routine for your workforce. The way it works is you apply for the Safer at Work verified seal, you complete a risk assessment where someone like myself or my colleagues would come out and do a gap assessment to address any possible findings that you may encounter with bringing people back on site. Next, you would do an on-site audit against our Safer at Work verified standard. Once you complete that audit, an audit report with any findings and your total score will be issued. If necessary, you would then address and remediate any possible findings, and then the remediation plan is submitted and then reviewed by our technical experts. And then once you pass this assessment, you are granted the Safer at Work verified seal, which you can obviously display for your employees and your customers to see. The real benefit here is to allow people to understand that you are taking a proactive approach at limiting the risk of COVID-19, and you've thought carefully about how you're going to bring people back to work. Okay, thank you.
Okay, so now we're going to take you through a little bit more on our offering on some ancillary services that we do through some shared providers. And then I'm going to give you a single example of a real practical way that you can address some of the tools that we've given you. So we can help you with identifying the risk that you have in your facility, looking at the number of positives of antibody testing and of PCR testing, what the environment is in your local county. We can help with employee screening. We have consent and symptom tracking forms that we can help you develop. We also have access to a contact tracing program. And this is a smaller than a typical cell phone, smaller than a pager type of device worn by an individual employee. And it actually alarms and lets you know when you're within 6 feet of somebody else who is similarly equipped. And it's recording what contacts you have. That way, if you have an outbreak in your facility or if you have somebody who tests positive, you know who those first contact individuals are. And then finally, for a lot of the on-site sample collection, whether it's a blood draw for the antibody testing or application of the nasal swabs, we do have a collaborative relationship with healthcare providers, and we can provide flexible hour services to those medical professionals to help you get set up. So basically, one call to Eurofins, we can take care of your program consulting, your whole program setup, forms, and employee follow-up. So on the next slide, we've given you a lot of information, and I gotta believe that there are 3 questions that are really important to you. After hearing all this, how do I apply it? What's the simplest strategy that I could actually just go after right now and get in place? And then finally, what's the impact going to be to my budget? So I'm going to try and address those for you. So on the next slide, we're looking at really 3 phases of tracking the virus: detection, determination, and disinfection. In this example, we're going to use worn mask testing as a first step in the sample program to see if your facility has contamination. So what this would involve is providing the disposable masks, single-use masks to your employees, and that's the typical polypropylene non-woven masks that you see and are readily available at this point in the pandemic. You collect those masks at, say, the first meal break of your work shift, provide them a new mask. The masks are individually labeled, individually put into a baggie, and then they're shipped to Eurofins. If that shipment goes out, say at 3:30 in the afternoon, it arrives at Eurofins early in the next morning, we will be able to test those masks and then return a result to you within about 36 hours. So by the close of business on that second day. Let's say one of the masks comes back and it's been positive for the virus. That's not a diagnosis of disease. That is purely indicating that the mask was positive. We'd provide that mask number back to you, and you'd be able to go back in your records and say, okay, that mask was handled by this employee, and we're going to encourage that employee to go out and get a nasal swab that would be clinically diagnostic for the virus to find out if they're positive or negative. While that employee is getting that testing taken care of and you're pending on that result, it might be a good policy to advise the employee to work from home during that period. And then finally, in order to ease some of the tension in the workplace that comes from, this individual worked at this workstation, is that workstation contaminated? We can help advise on how to clean and sanitize that, and then swab it afterward to ensure that the surface comes back and is free of the virus. And then we'd encourage you to communicate those results to your workforce saying, yes, this individual tested positive, we've sanitized their workstation, here's the evidence that it was clean. Go on to the next slide, please. So to put this into just a real quick application note, how do you get started in this type of program? Well, first thing you do is you establish an account with Eurofins. We train you to use our online portal for sample submission and being able to view results immediately on that online portal. So we're not necessarily waiting for emails or postal services. You need to go ahead and supply a source of the non-medical 3-ply masks, readily available blue or yellow masks that you see. Have those available to your employees as they come to work. You need to come up with a collection plan, and I've got kind of a plan A, plan B, and plan C here detailed. One would be to do semi-weekly sampling of the masks. So what we encourage is a Monday, Thursday collection. Monday, you're catching your employees from that Friday, Saturday, Sunday coming out of the weekend. Get them sampled, you have results back by Tuesday. You sample on Thursday, you're really looking from Monday, Tuesday, Wednesday, the prior 3 days, to be able to, again, have results by Friday and provide that feedback to your employees. In general, and this is in the most general terms, the virus takes about 72 hours before it begins to show up symptomatically. And we believe this type of program would actually preemptively catch symptomatic individuals ahead of them even knowing that they were sick. Alternatively, if you're in a low incidence county or area, virus is really not prevalent, you could do a weekly sampling of masks where you grab 25% of the masks every week. That way you're testing all your employees on a monthly basis as a means of surveillance to see if the virus has come into the facility. Achieving the same sampling impact would be to just collect the masks 1 day a month and test. Probably not quite as effective as either of the other two plans, but certainly logistically maybe easier. When you collect the masks, we'd ask that the employee actually fold those ear to ear, put them into a bag, and that bag can be as simple as a Ziploc, a clean new Ziploc sandwich bag. We'd have a supervisor ensure that they're individually labeled, collected, and then shipped. And then, as I've said, we will take 10 of the masks, test them all at once. That's how we get the economies of scale. Provide a result back on those 10 masks that's either positive or negative. If it is a positive pool of 10 masks, we would encourage you to authorize us to go ahead and do a breakout, and we'd then test the same mask individually to let you know that you have a single employee with a contaminated mask. Generally, results in either case are back to you within 36 hours. Let's go ahead to the next slide. If I took a model facility and said, well, you got 36 employees, you're going to collect those masks every Monday, every Thursday. When you're doing that, so you've got a total of 8 pools of masks that you're collecting in a month. Let's assume one of those comes back positive. Let's assume that you're going to go ahead and tell us that, hey, if you got a positive pool, do the breakout and test all 10 masks individually and provide me feedback. And that when you have that positive mask, you're going to go to a workstation and you're going to swab 6 different surfaces to make sure that you've got it disinfected. So all of that testing ends up being wrapped up in what I'm showing in the bottom table. So 32 pooled mask tests per month, 10 individual mask tests, a diagnostic nasal swab, 6 environmental swabs. For that group of 36 employees, you're going to burn through 1,500 masks in a month. Cost of those typically is around 40 cents a mask. All of that ends up being less than $200 per employee per month. Now you compare that to the cost of doing clinical swabbing at the same frequency, it's about a quarter of the cost. So with that, go to the next slide. So we're really advocating here this 1, 2, 3 approach: detect, determine, disinfect. Seems to be a fairly straightforward and simple way to go. And on our next slide, our entire program is consulting surfaces. We do a variety of testing available to you, whether it's staff PCR testing, antibody testing to see what the incidence of the virus has been in your population. We can test environmental surfaces to make sure that you have a good, clean, effective sanitation program. And then we can do site wastewater testing and use mask testing as a sentinel program without having to do the specific staff, individual staff testing. Next slide. The nice thing about this program is it is applicable to every single situation that you can encounter, whether it's a healthcare situation where you have high incidence of exposure to food production, to call centers, restaurants, all the way through the entire spectrum of businesses that are looking to return and have a safer at work program. Next slide. We're going to close with, we opened with the perspective of Eurofins and how we are this global organization. And one of the things that happened very early in the pandemic, as early as late January, early February, is the founder and CEO, Joe Martin of Eurofins, came out and specifically grabbed onto this and said, who is better to take care of a pandemic than the thousands, tens of thousands of Eurofins employees around the world? So the quote we have for him is, as the world faces the challenges of COVID-19, at Eurofins, we are ever mindful of our vision in the race to bring all of our resources to bear on the saving of lives during the crisis. So with that, Genevieve, I'll turn it back over to you.
All right, thank you. Okay, so before we go into our Q&A session, I just want to tell you about a few more resources that are available for you. You can check out training videos for coronavirus environmental sampling on our YouTube channel. That's linked here. And you'll receive this presentation after the webinar within 3 business days. So you can check us out. Our account is Eurofins US Food Group. And we also have some supporting collateral. We have some case studies, including in skilled nursing study, a call center, and manufacturing studies that we'll share with you after this webinar, along with a copy of our slides. Okay, and one last thing, we're going to have a quick polling question. And the polling question should be on your screen now. Do you want a Eurofins representative to reach out to you regarding safer at work services discussed in this webinar? So that includes all of the different types of testing and services that Jennifer and Richard discussed in their presentations. Select your response from this slide. I'll leave the poll open for about 30 seconds before we move into Q&A. Okay, and if you're not able to select one of the answer choices for whatever reason, you can just submit your answer via the questions function in your webinar sidebar menu. So we're going to open it up to Q&A with our speakers. If you have any questions regarding information covered in this presentation, or if there's anything you want clarification on, you can use your GoToWebinar sidebar menu. Type in your answer, your question, and hit enter on your keyboard to submit your question. Okay, so our first question is, what do you recommend for long-term COVID management besides just clinical or testing each of your employees every week?
So I'll go ahead and start off on that. For long-term COVID management, what we would really recommend is that you step back and look at where the virus is in your county, in your area, what the nature of your business is. So if you have high travel going on in your organization, you have a sales force that's out there and calling, that would call for one different response from, for example, having a call center where people are coming to the same workplace. So you end up with this different approaches for different businesses, all based on what's the incidence of the virus look like. Longer term in both of those cases is really to have a thoughtful plan put together, be able to communicate to your employees so that they know you are doing something, collect their feedback so that you can make sure they're feeling comfortable with the actions you're taking. and get consensus from them that this is the best possible outcome that you can have, and then go forward with that. So it's not I'm not giving you a real specific answer, but that's because it gets so unique to the dynamics of the population that you're working with. Jen, do you have anything you would add to that?
Yes, I think the only thing I'd like to add is it really helps to have a pre-developed plan in place so that when you do have an employee test positive, you already know how you're going to react, and you already know how you're going to mitigate that risk for the rest of the employees that may have been associated with that individual. So having that pre-developed plan is going to help you react in a effective and real-time response.
All right, thank you. Okay, our next question. What steps should I take if I'm trying to bring all my workers back on site?
This is Jen. I can certainly add to that question, and I think add on my last statement. I think before you bring your employees back on site, it really does help again to have that pre-developed infectious disease plan in place. That way, again, if you do have an outbreak on site within your employees, or perhaps in your region or city, there's an uptick in infectivity, you can respond appropriately by limiting the amount of risk for those that are not infected. Anything else to add there, Richard?
Well, there's going to be a certain urgency to bringing employees back to work. We've all been out of our traditional work environment now for some months. And within the Eurofins organization, as essential laboratories, essential workers, we've developed approaches that over the course of the pandemic that we feel are very workable toward keeping folks comfortable and at their workstations. I think as the urgency to bring people back comes forward, what we've given you today is a few tools that you could say, okay, we could start work on Monday, getting set up with an account, getting set up to do something like mask testing. That takes care of that critical need of how fast can we get back? And then we could work with you to further refine and tool the program.
Great, thank you. Okay, our next question. Okay, if I don't currently have an outbreak at my company, why should I perform testing?
Yeah, and that's a good, excellent question to ask. If you have a small population in your organization and they are a disciplined group of people who are taking all the right prudent precautions, you would end up in a situation where you're doing testing week after week that all comes back negative. And that can lead to a certain sense of comfort and also complacency. What I'd quickly point out to you, though, is if one person came into that small, intimate work environment infected, they run the risk then of taking out your entire population. And now you're going to be shut down for 2 weeks while you're quarantined. And from folks I've talked to that have the virus, they're not working at home when they have the virus. They're pretty sick individuals, even for mild cases. So the advantage here is that you're really guarding against that impactful outage that just stops your business for a couple weeks.
Okay, thank you. Our next question, how do you identify potential asymptomatic shedders?
Yeah, it'd be handy if they all wore a red mask, as Jen's graphic showed, but they don't. What our limited experience is, what we would like to do as scientists is we would like to have somebody who's wearing a mask every day and sending it to us for testing. And then we'd like them to contract the virus and continue to wear the mask and then be able to test every day as they go through the course of the disease. Great experiment. Unfortunately, it'll just never happen. You can't design that experiment to occur. What we have discovered fairly anecdotally is that we can detect the virus typically the day before symptoms show up in somebody's shedding. And we did this by, we had a household where we had somebody who was symptomatic and sick, and then we had 3 or 4 family members, I think it was 4 family members in that household wearing masks and saying them back to us. Ultimately, they all contracted the virus because of the living situation. And we realized from that small group of people that the day before they became symptomatic, we detected the virus in their mask. And interesting to us was 3 days after the onset of symptoms, we no longer detected the virus in their mask. So how do you detect the asymptomatic shedders? Well, at the point that they're getting a bloom of the virus before they become symptomatic, we should be able to see them. People vary a lot, so there's no guarantees, but we do expect that. If they are carrying a low level amount of the virus, we probably will not detect it in the mask, but that's why they're wearing the mask, is to minimize the spread from healthy individuals with low level detection.
Right, thank you. Okay, our next question, how do I protect employees on a multi-building campus? So I think this is asking about large populations of workers.
I think this is Jen. I think again, so if you're working on a multi-site campus or a single room in a shared building, it all comes down to, again, having that pre-developed plan in place so that employees know how to behave when they're showing up on site, and how to move about from one building or one room to another to limit that risk associated with coming in contact with another employee.
So within Eurofins, what we're doing in some of our larger campuses is we have greatly limited the ability of employees to go from one section of a large building or from building to building. During the pandemic, as long as we operate in a restricted workflow manner, we have to have handoff points for things like samples and paperwork, and some of the larger congregate areas like cafeterias and have restricted access for time of day. So to what Jen is speaking about is you have to have a predefined program that addresses where you expect the contamination to come from and how you would expect it to spread.
All right, thank you. Our next question is, does the surface testing detect whether the virus is still viable for transmitting COVID-19?
Yeah, the earliest study that came out from it wasn't directly from the CDC, but came out through their website, referred back to the Princess Cruise Line ship in Tokyo Harbor, where 17 days after the ship had been vacated from infected individuals, the virus, and I would do that in air quotes, was still recoverable from surfaces in that ship. We now know, as we've learned more about the virus, that it was probably not infective virus that was recovered, but in fact it was RNA from the virus that was still on the surface. And that is in fact what we are testing for, whether it is the nasal swab or a surface swab. We're testing for that residual RNA. We are not testing for infective virus. The studies that have been published, I think, are fairly well cited and accepted now, says that the virus is not infective on most surfaces past about 80 hours or roughly 3 days. So doing any kind of surveillance for infective virus beyond that period won't say that you have an infective surface, but it would tell you whether you had an adequately cleaned surface.
All right, thank you. And that is all of our questions that we have received. If you have any additional questions, you can reach out to us. Check out our website. Remember that all of our registrants for today's webinar will receive an email within 3 business days that includes a copy of the slide deck, a recording of the webinar, as well as those studies included at the end of the presentation. All right, have a great rest of your day, and thank you for joining us.